Years ago, we used to transplant larger groupings of these. They were called mini grafts, and in the old days they were plugs. So it was a large number of hairs in one piece of tissue. So now, over the years, the technique has become so refined that we can transplant a single hair, 2 or 3 hairs at a time, 4 hairs, and then what we do is we group those together in a way that builds density in specific areas of the scalp where you would expect to see it. We're able to put small single hair grafts all along the hairline to define that, so it looks quite natural. But it's been an evolution. I mean, this has taken, I've been in the business 20 years now, and it's really taken a long time to get from, plugs to, this ultra-refined follicular unit transplantation. Hair is removed from a donor area part of the scalp. And that's typically on the sides and back. And these are parts of the scalp where the hair is programmed, as it were, from your DNA that it will not fall out due to hereditary hair loss. There's 2 main methods to be able to remove tissue from the back of the scalp. The most common method is what we call a strip harvesting, where we remove a single strip of scalp, and the length and the width depends on the amount of hairs to be transplanted. Typically, the strip is about a centimeter or so wide, maybe up to ½ an inch in some cases. But it all depends on how elastic and how much give there is in the scalp. Your skin has some flexibility, so we're able to remove a piece of tissue, and ultimately you should have a scar that looks just like the crease in the palm of your hand. So it's well hidden by the hair, it's unobtrusive, and in some cases it's hard to see even if you shaved your head. But in most cases, an average scar is something that is not hard to cover up with your hair. The technique for transplanting the hairs once they've been removed from the donor area really depends on the area that we're trying to reconstruct or restore. In most cases, it's going to be in the front, hairline area, or in these receding areas of the hairline for a male. In a woman, it's going to be more or less, they'll tend to retain their hairline, so the hairs are going to be transplanted across the entire top of the scalp. The key is to be able to try and recreate something that you would expect to see naturally. What I've noticed is that there's hair follicles will grow out 4 or 5 or 6 at a time, and they form these little structures, and it's like a 3-dimensional, it's like a teepee, so the hairs will kind of grow up and together like this in a convergent manner, so that when you look at them, they form a little structure. It looks like an arrowhead or whatever. But if you look at it from the side, you notice that the hairs, the follicles in the back are like this, and the ones in the front are more upright. So again, they form this 3-dimensional structure that converges and puts that hair all together, so it has some substance and you can see it. And then if you look a little closer, you can see that these patterns repeat themselves. So these little groupings will in turn form other groupings that are the same structure but only on a larger scale. As I've been working with these, I've figured out that you can create larger patterns like this without recreating all the smallest little groupings and still end up with a better result in terms of how thick the hair looks, even when working with the same amount of hair. We're always working at a deficit because in transplantation of hairs we never be able to recreate the original density of hair because we don't have enough donor hair to do that. It's just a simple math equation here. So the key is being able to arrange these hairs and these follicles in such a way so that it allows the brain to see more than what's really there. Again, that gets back to the architecture of developing all these little groupings of hairs in a way that comes out easier and sooner, that the brain recognizes them quicker. What I try and tell patients is that, look, hair loss occurs on a continuum. It's not like you wake up one day and you have all this hair gone and the next day it's this much and so forth. It's one hair at a time.